Hey, Kathy, you ever get a referral that says shoulder pain, evaluate and treat? And then the patient comes in and they're holding on to their left knee.
All the time. Yeah, today we're talking about what PTs and chiropractors wish physicians knew. Because sometimes we need a decoder ring.
Amen to that. And sometimes physicians need to know that we're not, in fact, just massage therapists with extra paperwork.
That's right. Let's clear the air.
Mm-hmm.
This is the pitch.
What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. Hey, y'all. Welcome back to the Pitch Podcast. I'm Dr. Jason Young.
And I'm Dr. Kathy Lynch.
Yes, and look at us. Look at us in our handsome shirts.
Yes.
Yes, it says NARD.
Yes.
Not
And
a
it's
real
got
doctor.
the logo on the
Oh,
back.
yes, the Pitch Podcast logo. Hey,
Don't
Kathy,
we all want one?
can just anybody get one of these?
Anybody.
Yes, you don't even have to be a real doctor to wear a NARD shirt.
What a great Christmas or Hanukkah gift.
Absolutely. Yes, Christmas, Hanukkah. I don't do Kwanzaa.
Okay.
I don't.
Festivus?
But if you do Festivus for the rest of us,
Yes.
right? So, or, you don't need an occasion, right? Like
Right.
my wife and I did that thing where it's like, hey, listen, we're not going to get each other gifts this year, right? Our love is enough.
Yeah.
And so I was like, well, wait a minute. I already bought you something. She's like, you don't need an occasion to give me a gift. So yeah, you don't need an occasion, y'all. Just go
That's
to pitchpodcast.shop/swag and you can get a NARD shirt that comes in 3 colors,
Yes.
right? There's lots of other
I
good
got
stuff.
blue.
On there. Yes,
You got black.
and this is black,
Mhm.
right? So if you're not watching our video podcast, which is
Right.
in the top 15%
That's right.
of video podcasts on Spotify, then we just need to tell you the color of everything. My iPad case is white.
Okay.
Her MacBook is silver.
Okay, let's get
Yes.
into the
Okay. I am an African American man, and she is a white Irish woman.
That's right.
So yes.
Okay.
Well, tell me, this episode was your idea.
It was.
And I was like,
You
I was all in
you
on it.
responded immediately.
Oh, immediately.
Love it.
Yeah,
Perfect.
like
Let's go.
I was real time responding to this as the text message was flying through the air. Yeah. So what were you thinking with this one, Kathy?
Well, really what I was thinking, I kind of want physicians to know what we know,
yes.
because then it can help them to refer to us. And then because not that we need a referral,
Mhm.
we don't need a referral. However, when a physician refers to us and says, hey, physical therapy is really going to help, guess what? The outcomes are way better when the
Mhm.
doctor says it's going to help.
Yeah, totally. And do you work for the physician?
I do not work for the
You
physician.
do not, right?
No,
You are a colleague,
I am a colleague.
not
We're
a subordinate.
We're peers.
Yes, we are. And so I think that people may not understand that there's kind of this dynamic that
Mhm.
exists within healthcare. And I feel like lately it's a dynamic that has had gasoline tossed on top of it, where you have a lot of, well, when I say medical doctors, I mean
Mhm.
medical doctors and DOs,
Right.
which, disclaimer, first of all, we love all of you.
We do.
We do.
We
Yeah.
do.
We've had doctors on the show,
Yeah.
right? And we value those relationships and they're good. And most of these doctors we get along very well with.
Yes.
But there's just kind of I don't know, we don't know what you're talking about in the break room. We don't know what you're talking about behind closed doors.
Yeah.
But there's kind of this sentiment that exists out there where I think that there's a lot of medical doctors where they kind of feel attacked.
Yes.
Or like maybe their territory is being encroached upon
Mhm.
as other types of healthcare providers have expanded scope, expanded responsibility. And so let's clear the air about
Yeah.
some of that.
Yeah, we just want to be a team.
Totally.
I'm a team player.
Yeah, and the patients deserve that.
Yeah.
Right?
Yeah.
No patient gets value out of us beefing about things. Right? And so it's like, yeah, we can talk all day about what's wrong with Mrs. Jones,
Mhm.
but if she doesn't get the healthcare that she needs, then we're all idiots.
Yeah, all of
So
us are useless.
all of us are useless.
Yeah,
So yeah, I think like one of the things, first of all, maybe that we could talk about is the whole doctor title.
yeah,
Okay.
yeah,
Because it's, new and fairly controversial
mhm,
in the world of physical therapy.
yeah,
Um, uh, Chiropractors, we've had that doctor title for a
mhm,
long time. But one of the criticisms out there is that, hey, chiropractor, when you call yourself a doctor, everybody's thinking medical doctor.
mhm,
And then they want to listen to your advice, but you're not giving medical advice.
hmm,
So you need to stop it and call yourself something else, literally anything else. And you, physical therapist, you're not
ew,
a doctor,
no,
right? You're not a real
not a
doctor.
real one, you
Yes.
nard.
I just read you're not a real doctor. So, I don't know, what do you think about that? What's your response to that type of thinking?
Yeah, well, my diploma says doctor of
It
physical
does.
therapy,
Mhm.
and one of the reasons the profession went this way was we wanted autonomy.
Mm.
We wanna kinda get away from, like, the hierarchical, scaffolding that had been set, where the medical doctor says, "This is what you gotta do," and the physical therapist has to do it.
Yes.
Yes.
And one of the problems with that is medical doctors don't know what physical therapists
That's
do.
right.
If they did,
That's right.
they'd be doing it,
They would be
right?
doing it. Yeah.
Yeah, and I think that that's one of the myths about physicians. Now, don't get me wrong.
Mm-mm.
When it comes to healthcare, there is nobody that is even close to as well trained
Right.
as a medical doctor, especially a specialist. So,
Right.
like a surgeon or something like that. Nobody even comes close. I don't have half the education,
Nope.
or
I don't.
maybe approaching a third,
Mhm.
right?
Mhm.
And so it's an incredible commitment. They're incredible resources, but the issue is that they don't study what I study, they don't
Right.
study what you study,
Right.
and so they don't know everything, and we all need to help each other,
Right.
right?
And when we're talking about is more of the primary care or internal medicine physicians who don't get a lot of musculoskeletal training,
Right.
right? Orthopedic surgeons, osteopathic docs, obviously they're getting a lot of musculoskeletal training.
Mhm.
And so for the most part in this episode, we're mostly speaking about those primary care physicians,
Yeah.
internal medicine.
Yeah, and I
Yeah.
think so too. And, even with the DOs, they do get more musculoskeletal
Mhm.
training, but they still don't get as much as we do.
No.
I think one of the little known facts about chiropractic school is we actually get pharmacological training.
Mhm.
And it is about 10 hours of education.
Mm.
And so that is definitely not enough to earn me prescriptive
No.
rights anywhere. But the reason that we have it is because we need to be able to keep people safe. And
Right.
so if you come in to my practice and I'm looking through your medication list with the purpose of understanding your health history, not with the purpose of saying, oh, you should take more of this or not
Right.
that or anything like that,
Right.
because that's outside of my scope. But like, for example, I need to know if somebody is taking a fluoroquinolone, and I
Yes.
need to know what that is
Yes.
because it's a type of antibiotic
Mhm.
that is going to affect the quality of your tendons and ligaments and
Yes.
everything. And so, if I don't understand what a fluoroquinolone is, then I could be putting a patient at risk,
Yep.
right? If I take your blood pressure and I see that you're not on blood pressure medication,
Right.
I need to know to refer you to your physician,
That's right.
to have that conversation and do those things. And
Yeah.
so, um,
We had a course in pharmaceuticals as
yeah,
well,
yeah,
for the same reason,
yeah,
right? Statins
mhm,
um, are known to cause a lot of musculoskeletal pain,
right,
and so that's something I learned in PT school. Like if
exactly.
somebody's on a statin, not that I'm going to tell them, "Hey, don't take the statin,"
Mhm.
but hey, go ask your doc and see if you can find a different statin that might help you with this pain.
Yeah, and I'm gonna go so far as to say that, because we're not all the chiropractors or all the physical
Right.
therapists, and so we don't have control over what some of the dummies out there are doing. But no, so if your chiropractor is like, "You need to get off that statin,"
Yeah.
or "You need to quit taking this," or "You need to
Mhm.
quit taking that," do not listen to that
Do
chiropractor.
not
No,
listen.
If your physical therapist tells you, you need to quit taking this or you need to start taking that,
Yeah.
do not listen to that
Don't
physical
listen.
therapist
No,
because that's not in our scope.
it's not in our scope.
So we should be saying, you need to go talk to your doctor,
Yeah.
preferably the doctor who prescribed you the medication.
Yes, that one.
And we can help give you some useful tips in terms
Mhm.
of here's a question that you ask
Mhm.
and things like that. But see, doctors, we're not trying to step on your
We
toes.
are not.
But the reason I bring up the pharmaceutical classes is because that is pretty close to the level of education that we get about pharmaceuticals.
Yes.
That's pretty close to the level of education that an MD is getting about musculoskeletal
That's
problems.
right.
Right.
That's right.
That is why so many of you are being diagnosed with strains and sprains whenever you go to your medical doctor. Oh, you're just having back spasms,
Yes.
right?
It's just a spasm.
Yeah,
It'll be
you
okay.
sprained your shoulder. That's
Yeah,
it. Yeah.
no doubt.
Mhm.
No
Yeah.
doubt.
So,
That's water on the knee.
yeah. Yeah. So, and that is why we exist, is because physicians can't do it all,
Yeah.
right? And it wouldn't be reasonable to expect them to. General practitioner, hats off to you. I
Oh,
respect you.
man.
Like, I think that I think your job's a nightmare, honestly.
Such a hard job.
Yeah, you're expected to
Mhm.
know about everything.
Mhm.
And culturally, when we
Yeah.
think about medical doctors, like think about some of these TV shows like Grey's Anatomy,
Mhm.
House, ER,
Yeah.
all these kinds of things, St.
Oh,
Elsewhere,
that's what I was
right?
thinking of. Yes.
General Hospital.
Uh-huh.
The doctor, our culture says that the medical doctor has to have an answer.
Right.
They're expected to be able to find the solution, and it
Right.
has to be in 30 minutes.
22 with commercials.
22 with commercials, right? And what an incredible burden, because
Yeah.
that is the culture that
Mhm.
is put on physicians. And when you look at those types of things, it is almost exclusively the doctor descending from above with the shot or the pill or whatever.
Mhm.
But you ask a general practitioner, how often is it that you are talking with somebody and the solution to their problem is a shot or a pill?
Yeah.
Most of them are going to tell you it's not that often, right?
Right.
Like, they
Right.
use it a lot, it's a
Yeah.
tool, but a lot of it is about the conversation, giving people confidence in themselves,
Mhm.
their ability to take care of themselves, and that's not different for
Right.
you and I.
Right.
Yeah.
Yeah, and going back to the training, I feel like I've told this story before, but at Colorado, we took 2 16-week terms of cadaver lab.
Mm,
And so one was in our first year where we kind of dissected down to the muscles and the nerves and, had to identify all the muscles and nerves. And then, so uh, second year med students were the teaching assistants
of
for
course.
those labs.
Mhm.
And that was great. Um, and then in my second year in PT school, we were in cadaver lab, and this time we dissected down to the joints so we could actually see, like, how does that knee move? How does the
Mhm.
tibia and the femur articulate and the shoulder joint? And what we found a lot of times was, as we're in the cadaver lab, the same time as some of the first year PTs and the um, medical students were TAs, and they didn't have the answer to like one of the first year's questions, and they'd say,
Mhm.
"Hold on, let me go ask the second year PT student,"
Uh-huh.
because it was a
Yeah.
musculoskeletal question. They're like, "I think I know somebody else that can answer this question."
Yeah.
So yeah, we got way more training in the cadaver lab with muscles, nerves, joints
Yeah.
than the medical students did, and they knew it,
Yeah.
right?
Well, some of them know it.
Well, you're
If you
right.
go if you
Some
go
of
on
them
social
knew it.
media, so
Yeah,
on
yeah,
social
yeah.
media, there's this lady on there who she's a med student, and she loves anything. Well, as a med student, I have more training than any chiropractor, blah blah blah. And so she just goes out finding videos
Mhm.
of chiropractors who are acting crazy, and you can find them. They're
Oh
not
yeah.
they're not hard to find,
No.
right? And I think this is kind of a trend right now. Medical doctors going out and they're like, "Oh, I'm going to find a video of a chiropractor. I'm going to rip it
Uh,
apart." And it's like the whole reason they do it is because it's engagement farming, right? They're going to
mhm.
get a lot of
Yeah.
comments.
Yeah.
People like, "Oh, I hate chiropractors. Like
Uh-huh.
a chiropractor murdered my family. Came in and adjusted everybody, and like we found him by the fireplace." And yeah, it's like so silly stuff like that. But it's just like the audacity of this
Yeah.
med student, and
Yeah.
it's like, listen. if we sat down and we talked musculoskeletal stuff,
Mhm.
I guarantee you,
Yes.
med student who's going into radiology, you don't know what I know,
Mhm.
right?
No doubt.
And so I think some of that isn't her fault. I
No.
think some of that is just instilled in her. But we're having this big kind of healthcare war that we
Mhm.
don't need to.
No.
Because here's the fact.
Yeah.
There is not enough of any of us
None.
to
No.
deal with the current demand.
No.
Yeah,
We all need to band together. Hold the
absolutely.
line.
Hold the line. Yeah. I mean, I don't even know how it happened. I mean, there's more people than before, but I actually, so there are COVID took a lot of healthcare
Mhm.
providers out of
Absolutely.
healthcare.
Yeah.
Lost a lot of nurses,
Yeah.
lost a lot of doctors.
Mhm.
They're not dead. They just
No,
they burned out.
they did, they're totally burned out.
Yeah. And so on the other side of that, we have fewer and fewer healthcare providers and they're not being trained any faster.
Right. No.
Um, I think that there's been a movement to kind of beef up the number of PAs out there,
Yeah.
which a PA is a great and sometimes terrible idea.
Yeah.
So
Mhm.
PAs, it's like you're doing doctor stuff with 2 years of training
Yeah.
with the understanding that, you're working with some supervision, which is great. And it makes sense from the standpoint of we need frontline healthcare
Yes.
people.
Yes.
I've met some PAs who it's like, wow. But
They're that good.
yeah, yeah, that's what I meant. I'm like, wow, just 2 years. Just 2 years, huh? And that's more the exception than the
Right.
rule.
Right, right.
But there's also medical doctors out there that
Yeah.
you're like, wow,
Mm.
you're just that good. And that's all. No better. So, and we've all got them, right?
Yeah.
I think every profession has people where it's like, yeah, this person's kind of an
Right.
embarrassment.
Right.
Um, so fun fact though,
Yeah.
did you know, and some people, well, you're not a physician, you're a chiropractor.
Yes.
So do you know who gets to say who can and cannot be called a doctor or a physician?
Ooh, no, tell me.
So that is decided state by state.
Oh.
Yes, it is decided by your state legislature.
Oh.
So sometimes people are like, "You're not a doctor, you're a chiropractor." I'm like, "Well, go to Salem. Go to Salem and tell them that because, I mean, they're the ones who told me that I can put on my card chiropractic physician." "Well, but you're not a physician." "Okay, go
All
tell
right.
them. Don't
Yeah.
tell me."
Yeah.
Right? And so, any state that you're in, there are rules that it's typically in your state, it's gonna be called the Doctor's Title Act.
Mm.
And there are rules around who can use that title doctor, who could use the term physician,
Mm. Mm.
as specifically as it pertains to healthcare.
Yeah.
And so in the state of Oregon, for example, you are not allowed to call yourself doctor anything without also identifying the type of doctor that you are.
Mhm.
So when I was on the state licensing board, this is a very common citation that we would give to people is in their advertising, they'd
Mm.
just be like, I'm Dr. Smith Johnson,
Mhm.
and you should come see me. And it's like, okay, what kind of doctor are you?
Mm.
And it's like, sometimes they just leave it out. Sometimes I don't know. The accusation is that you don't want to say that you're a chiropractor because you want to trick people, and it's like, bro, eventually they're gonna find out.
They're gonna know.
Yeah, it's like probably around the time that it comes to pay a bill or something, they're gonna figure out that you're a chiropractor. Um, and I get it. It comes more in the realm of like I'm putting advice out and
Right.
things like that.
Right.
But yeah, so your legislature in your state gets to say who gets to be a doctor. In Oregon, like if I'm going to tell you I'm Dr. Jason Young, like when you hear the Pitch podcast, I say like I'm a
Yeah.
chiropractor, right? And we followed up with that. The only people who don't follow that rule,
Mm.
like often,
Medical
medical
doctors.
doctors.
Yeah.
Yeah, right.
That's a really good point.
Yeah, well, and I understand why it's
Yeah.
because culturally, when you think
Culture.
about
Yeah.
doctor, you're thinking medical doctor,
Mhm.
like Jill
Mhm.
Biden.
Yeah.
Do
Doctor.
you remember that?
Oh, man. The
Yeah,
uproar. Can we go
yeah,
back to those days?
yeah. We're like, "Well, Jill Biden
She's
isn't a real
not a
doctor."
real
No,
doctor.
she's not. We should
No.
send her a
We
shirt.
should send her
We
a
should send
shirt.
her a shirt. Yeah, she's a doctor of education. It's
Yeah.
like, yeah, you guys were saying that she helped people. She knows how to do mouth to mouth. Right,
She probably does know how to do
right.
CPR.
You were saying that she could remove an appendix. No, no,
We
she's
were not.
a doctor of education and still a doctor.
Still.
So, mhm.
Yeah.
It's
Yeah.
not a real doctor.
No, her diploma says doctor.
She's the truest of nards.
She is. She is the
So,
early nards.
the earliest nards, the nardiest nards of them all. So, well, oh
Okay.
geez, I feel like
Uh,
I need a drink of water. I'm gonna get a drink of water.
Okay.
Mhm.
I feel like we
Mm.
got a lot out of our
I feel like
chest
I probably just
already.
spilled that all over my shirt. So this is a good time to point out that, I mean, you might consider this a blooper, right? We have the premium subscriptions coming, and then like you can see stuff like you
Look
just
at
saw.
that.
Where I poured water all over myself.
Yeah.
So get a premium subscription to the Pitch Podcast, coming soon to an internet near you. All right.
All right. So some things we wish physicians knew. One of them is we would prefer that they refer to us sooner rather than later, than waiting. Like, hey, take these meds first, see if it helps.
Mm-hmm.
Then call, then try a physical therapy where we would, hey, how about if you want to give them the meds and
Yeah.
send them to PT or to chiropractor?
Yeah. Like what
Yeah.
kind of meds are you talking about? What do you got? What do you got for me?
Muscle relaxers.
Muscle relaxers. Yeah.
Commonly prescribed
Yeah.
because they want to give them something. They do.
Yeah.
They want to try to help.
Mm-hmm.
And, opioids luckily are falling out of favor.
Right.
Yeah. So we're going muscle relaxer.
Mm-hmm. Yeah. Well, and we brought this up before that most, we talked about it in the context of back pain, but
Yeah.
I would say like a lot of musculoskeletal things, they're just going to resolve on their
Yeah.
own anyway,
Right.
right? So there's a certain percentage of those. By the time somebody goes to see a doctor, they're looking to get better quickly, and so it's like understanding that, just figure out where you are in the timeline, and if it's like it's pretty early on, then yeah, maybe tell somebody like, go take an ibuprofen, and then like if it's not resolved in a week, then yeah, get us in the game,
Yeah.
right?
Right.
And bad news, your muscle relaxers, they're going to be sitting down at the end of the bench,
Yeah.
really. Yeah.
Yeah. They're not
I
getting in the game.
I can't remember ever having a conversation with the patient and being like, it would be really helpful to help get you better quicker. Why don't you go see your medical doctor? See if they'll give you some cyclobenzaprine, right? Uh,
No, that is not.
if you just had a little bit of flexible, like, are you,
Oh, flexible,
like,
yes.
yeah, I don't think I've ever had that conversation with
No.
somebody,
No.
and that's a patient that a general practitioner typically just doesn't even want to see,
Mhm.
right? And so it's like, just send them over. We'll
Mhm.
take good care of you. And the first thing that I do whenever somebody is referred by their medical doctor,
Yeah.
and this is funny too, because online people are like, medical doctors don't refer to chiropractors. Like, okay, like
Mm.
I probably get like 4 or 5 a week,
Yeah. Yeah.
and here's how I do it. You want the secret?
I do.
Okay. When like let's say you get referred to me,
Yeah.
and I have a doctor in town who sends a ton of people, and I can almost even spot the people that she sends at
Yeah.
this point. It's like, oh, I'm betting. So whenever they come in, they're like, oh yeah, the doctor sent me here, blah blah blah. And I was like, oh, who's your doctor? It's, oh, it's so and so. Like, okay, well, first of all, they're smart. They know what they're
Yeah.
doing. Like this was the right move. Like
Mhm.
this is a good thing to do. And I tell him, like, it's not a good thing that they sent you to me because she doesn't know what she's
No.
doing. I tell him, this is a really good move because we're going to work together
Yeah.
on this, right? We're going to be communicating, and we're going to help you get better together because a multimodal approach is
Yes.
superior in just about every case. So,
Yes.
what do
Yeah.
you like? How do you talk about people's doctors with them?
Who? That guy?
Yeah. Oh, geez.
Oh.
Yeah. Uh
I'll let that one
huh.
slip.
Uh-huh.
No. Yeah, I kind of have the same conversation with them. Um, we'll talk about. I will ask like, "Hey, what did the doctor say to you?" Because
Hmm.
I want to kind of hear what they heard from the doctor,
Yeah.
and sometimes what they heard isn't actually what was said.
Yeah.
But
Yes. Oh my gosh.
so I want
Uh,
physicians. This is something I
yeah.
want physicians to know,
Hmm.
that I know that some of the crazy things that are
Yes.
told to me, you didn't say that to
There's
them.
no way you said them. Right. Like some of the
It's what they
things that
heard.
my doctor said, he saw this on the X-ray. It's
Yes.
like, your doctor said that? No. No, no,
Yeah.
no.
So I want physicians to know I got your back.
Yeah, totally.
That I won't refute it to the patient, but I don't believe them.
Yeah. Yeah. And it's not the patient's fault
No,
either,
it's what
because
they heard.
how would they know?
Yeah,
They like, there's big words and all
yeah,
kinds of stuff. And
yeah.
yeah, so the goal is never to make a
Mm-mm.
doctor look bad.
No,
Well, I should say our goal.
our goal.
Now, I do know some chiropractors out there that that's kind of their MO.
Yeah,
And
yeah.
I'm kind of not mad at that
Uh-uh.
because it makes it really easy for me to look good next to it. But yeah,
Yeah.
I mean, there's certainly some chiropractors, PTs out there that will be like, "Oh, well this guy doesn't know.
Oh, he
You
doesn't know
don't
anything.
listen to him, blah
Yeah,
blah blah."
no.
And it's like I know that there's probably some medical doctor out there that's like, "See, I told you.
Yeah,
Look." But medical doctors like, "Aren't you doing the same thing to us?"
yeah.
"Oh, that's just a physical therapist," or, "Oh, a chiropractor. Yeah, I never send anybody to a chiropractor." I was like, "We don't have to be that way,
Uh-huh.
because who does that serve?"
Right. Nobody.
Well, it certainly doesn't serve the patient,
No,
right?
right.
And it doesn't matter if it's not serving you or it's not
Mhm,
serving me or it's not serving that
mhm,
doctor. It's about serving the patient.
mhm,
So,
mhm.
we gotta be nicer to
We
each
do
other.
have to hold the
Mhm.
line, hold the line.
Sure,
Yeah.
sure, let's just hold the line.
One of the other things, I want physicians to know that we know is we kinda know how to talk about pain
Mm,
because we do it all day, every day.
yeah.
We know and they probably do too, but guess what? We have a lot more time.
Yeah.
I get to spend 45 minutes with my patients
Mhm,
and they get 10
mhm.
minutes,
Yeah,
you
yeah,
know? And so I can follow up on pain education because we've talked about in the past how complex pain is, and it's not always a tissue issue.
yeah.
And so
Unless that
over
tissue is between your ears.
That's right. It's the brain issue.
Mhm.
Yeah. So, I want physicians to know that when I'm talking to patients about pain, I'm not equating pain with damage.
Yeah.
And I think that's an important thing for people to understand because people immediately think, "Oh, I must have torn that muscle.
Mhm.
I must have ripped it.
Yeah,
I sprained it."
yeah.
No, it's not always you're not gonna always see it on imaging, and we just had a
Mhm.
whole episode where we talk about early imaging,
Yeah.
and you'll have to go back and listen to that one.
Well, I think that's an interesting thing too, because sometimes that language is coming from the doctor,
Right.
right? Sometimes they say, "Oh yeah, you just tore this, or you just
Mhm.
ripped this,
Yeah,
or
yeah.
that's damage." And so, first of all, are you wrong about that? Maybe not.
Right,
But is that language useful?
right.
Often not,
Yes.
right? So, what I see a lot is doctors who are doing x-rays of patients' backs.
Mhm.
PS, look at the guidelines on when you should be doing imaging for musculoskeletal problems. If there's
Mhm.
not a trauma
Mhm.
or, some other indicator, you don't need to
Mhm.
do x-rays the first
Right.
time somebody comes in for lower back pain or neck pain or something
Please.
like that.
Yes.
Um, so follow the guidelines on early imaging. And then the other thing too is when you see degenerative changes or bone spurs and things like that, do not say the A word, which is arthritis. You like there's a certain percentage of patients that you just ruin. It makes it so hard
Mm.
for them to get better because
Yeah.
they hear, "Oh, my doctor saw arthritis on my x-ray." No, he did not. No, she did not, right? She didn't see arthritis because arthritis is joint
It's
inflammation.
inflammation,
You
yep.
cannot see that
Mhm.
on an X-ray.
Mhm.
So stop saying it. We
Yeah.
get it that it's like it's easy to say, it's an accessible concept that patients have heard about is arthritis, but just take a second and say, "Look, there's some changes to the bone."
Mhm.
And if they're over 40, 50, something like that, tell them it's probably associated with age.
Yeah.
And a lot of these don't end up being symptomatic.
Congratulations, you made it to 50.
Yeah.
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 Happy birthday.
Look at your x-rays.
Yeah.
They're
There
awesome,
you go.
right?
Yeah. You got gray hair, you got the arthritis.
Yeah,
Just it's a given.
it is gray hair of the spine.
It is.
Yeah. But it's just really easy to
Mhm.
say, especially I think when you need to get to the next patient. Look, you've got arthritis. We're gonna give you some meloxicam
Yeah.
and hopefully that fixes it.
Right.
And it's like you move on. And again, nobody's trying to do a bad job,
No.
but it's an overwhelming job where there's a lot of people and sometimes there's shortcuts taken just because that's not your area of expertise and
Mhm.
focus and training.
Mhm.
And so why not get somebody involved who wants to see that kind of
Yeah.
patient?
Yeah. 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 Oh, this one's one of my favorites.
Yeah. Hey, don't you just give people TheraBands? That's it, right? Yeah, you just give them a
Yeah,
TheraBand. They're good.
the
Uh-huh.
yellow ones. Here's a couple TheraBand
Mhm.
exercises.
Yeah.
You're
Oh, you
good to
just need to
go.
stretch.
Yeah,
Yeah,
let's
just stretch.
just stretch it out.
Yeah.
Yeah. Are TheraBands useful? Sometimes.
Totally. Could
Yes.
TheraBand be a sponsor?
They would be a great
They would be
sponsor.
an amazing sponsor.
Yeah,
You know how many TheraBands they would sell here?
so many.
I mean, we have 10 listeners, and each of them probably needs, like, what, 3 TheraBands?
Yeah, well, 6, all different colors.
Uh-huh,
Yeah,
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 and
yeah, yeah.
and I like to give out a good TheraBand for a Christmas gift or whatever, so yeah.
I mean, TheraBands are useful in the sense that people don't have dumbbells at home, and they
No,
don't wanna join a gym,
no,
so we gotta give them some kind of resistance training. So
yeah,
we'll start there.
and if you're traveling, is it easier to take a shake
Yeah.
weight
Oh.
or a TheraBand with you, right? I mean, we got weight
Well, what's
limits.
more fun?
Okay, that being
Yes.
said, shake weight, we do not want you as a sponsor.
Yeah,
Yeah, we've
sorry.
discussed it, and
Yeah,
no thanks.
sorry, the board has
Yeah,
ruled it out.
yeah. Okay,
Mhm.
so, you ever get, like, a doctor that refers somebody to you, and really what they're telling the person that you're gonna do is just massage?
Ooh, yeah,
Yeah, go
that one
see
hurts.
yeah, go see this, physical therapist, she'll give you a massage.
Mhm, mhm,
Yeah, and I think that that's another really important thing to talk about is and this comes down to networking.
mhm.
Networking is how
Yeah,
you and I know each other.
yeah,
We're in the same
yeah,
networking group,
yeah,
and, if you're in Corvallis, come check
yes,
out Corvallis Business Network.
yeah,
Great
best one in
networking group.
town.
Just leave us a comment, we'll give you the information.
Yeah,
Or you could just go to Corvallis.business.
yeah,
There it is. Now
okay.
they're sponsoring this episode,
Yep.
so we'll just collect from them later. Good news, guys. No, but networking is so important. It's
Yeah,
critical because, like, let's say that you're a medical doctor listening to this and, you're like, "Yeah, you know what? I do need to refer to some physical therapists,
mhm,
some chiropractors, whatever." And, like, where do you start? Like, who do you send them to?
yeah,
And so the ability to connect with people and network, and I think it's really important that, like I've had the most success whenever I approach anybody, whatever kind of provider they are, and I'm asking, what do you need? Like,
mhm,
what's something that I could give you or do for you that would be helpful?
mhm,
Right? And sometimes they ask things like, I don't "What do you do? What could you do?" Right? And, like, whenever I started working with athletes at Oregon State, I had that conversation with the medical director there. I was like, "So what do you think I could be doing that would
yeah,
help?" And he said, "One of the things you could do is, could you show our athletic trainers how to do manipulations?"
mm.
And I said, "No."
We're gonna pass on that one.
No, no,
No.
it takes, like, hundreds and hundreds of hours of
Hours.
practice to figure it out, and so, no, I'm not gonna do
No.
like, a short work I was like,
Uh,
"What's something else that I can do?"
yes.
But I think that that's an important conversation to have because it's like, why would a medical doctor refer to me?
Mhm.
And they have a picture of what it is that they think that I do.
Right.
And more than likely, the main thing they're thinking of is I'm going to give that person an adjustment,
Sure.
right? I'm going to be selling them some crack, right? So,
You're a crack dealer.
but that is one tool in the toolbox, but
Mhm.
it's not my only tool,
Right.
right? So when a doctor refers to a physical therapist, like
Mhm.
what is it in their mind that they think that you're going to be doing?
Mhm.
And how does that contrast with your whole tool set?
Mhm. Yeah. Um, I think it's funny. I'll I'll have patients that see their even an ortho physician, and the ortho physician's giving out exercises. And I'll say, "Can I see those exercises?" And I look at this sheet and I say, "Hmm, okay."
Yeah.
Are these helping?
Oh, goodness.
No.
Yeah.
Surprisingly, they're not helping.
Mhm. Huh.
Huh.
That's
Okay.
interesting.
Well, let's go over some of them, and maybe
Yeah.
we can, alter them a little bit.
Yeah.
Yeah. So, I do think that physicians send for just exercises. They think
Yeah.
I'm just gonna do exercises with them.
Right. And those exercises are going to be just a little bit better than their standard printed sheet
Yes.
of photocopied exercises that they give to everybody. Right? Like I've
Yes.
seen those sheets
You've seen
too.
them, right?
Oh gosh, like people they're like, "Oh yeah, they end up having what turns out to be like a disc
Yeah.
herniation." And I look at this sheet of exercises that their doctor gave them and it's like, "Yeah, you just need to spend some time bending forward and touching your toes." No,
Nope.
that's the
It's
opposite, the
literally
literal opposite of what you should be doing. And so it's like, yeah, it's having an understanding of the resource that you can be. So I refer a lot to you,
Yeah.
right?
Yeah.
And I also give exercises and I can give
Mhm.
exercises, but there is a specific reason that I'm sending people to you.
Right.
Part of that reason is because your skill set is not just around telling people, "Do this exercise," right? Anybody could do that,
Right.
right? But part of your skill set is helping people go through the puzzle solving, the problem solving,
Mhm.
steps of how do we work up to a good amount of load,
Right.
right? How I need to be able to do these skills. Can you help me be able to do these skills?
Mhm.
Like, what are the muscles that need to be working for that? And, like, how will I know if I'm ready in order to go out and do that in the real world? And so there's much more of a skill set than somebody can just see on, like, "Oh, here's a piece of paper."
Right.
And, I send people to you because of the way that you communicate with
Mhm.
people. There are some physical therapists that I don't send patients to, and it's because, by and large, they aren't communicating with patients.
Right.
They show up and they're like, we did our evaluation. Here's the exercise I want you to do. I'm going to hold this clipboard, type on this laptop
Mhm.
while you go and do that, and I'll observe you. And
Yeah.
it's like, nah,
No.
you're a coach,
Right.
and that's why I send people to you is because you're good at
Yeah.
coaching people, and that's
Yeah.
part of the skill set.
Yeah.
So,
And we've said this before too, like, we're taught in PT school how to do manipulations.
mhm.
Like, it's in my scope of practice. I can do it, and I do it once in a while, but I send them to you because 'cause you're the expert. Like, the velocity with which
Mhm.
you have to perform a manipulation is a skill that you learned over time, and I just don't do it enough to be that good at it.
Right.
Can I
And
do it? Sure, but it's
yeah.
not gonna be as good as the way you do it.
And there are some PTs out there that are great at
Sure.
manipulation. They're
Yeah.
really good at it. But again, it's like you said, that we have a finite amount of
Mhm.
training that we can do.
Right.
And so it's like, why wouldn't you find somebody who has a skill set that your patient needs? Not that
Yeah.
I need, that my
Right.
patient needs. Why wouldn't you send them to that
Right.
person?
Right.
I think a really easy reason is pride. Right?
Right?
Yeah,
I could do it all.
people don't like
Mhm.
admitting that they don't have all the answers, or sometimes they don't like admitting that they're wrong. Sometimes people will just try and cram the same old solution down your throat.
Mhm.
Um, one thing that, and again, I don't understand the competition sometimes, but one thing that's amazing to me is whenever uh, I have physicians that will try to dissuade people from coming to see a chiropractor
Mm.
because they're like, "It's dangerous.
Mm.
You're going to die,"
Mm.
right? Um, which again on social media we see this, and it's kind of funny because, well, it's not funny, but it's interesting. I'll say it's interesting. There's nothing funny about it, but it's interesting that you will see a social media post and they will tell the story of somebody who went and saw a chiropractor and then they ended up paralyzed, right? Or they
Right.
had a stroke.
Right.
And if you read these carefully enough,
Mhm.
there's a good percentage of them where if you look at the story, one thing that you're going to notice is that there was no malpractice claim that was
Mhm.
paid out
Mm.
or even filed.
Mm.
And the reason was because the chiropractor found out that the person was having a stroke, sent them to the hospital. They get to the hospital, they're like, "Who sent them? Oh, the chiropractor sent them. Oh, the
Oh,
chiropractor caused it,
caused it.
right?" Which, if you want to know, and you can go look this up, the rate at which people experience a vertebral artery dissection or a cervical artery dissection, which is a stroke that some people like to pin on chiropractors, the rate at which patients have those at a chiropractor or chiropractic clinic is exactly the same as the rate at which they have them
Mm,
at their primary care
no
doctor.
way.
Yeah, and so, it's it's so rare.
Yeah.
It's so incredibly rare, but
Mhm.
when you talk to some of these physicians about, "Oh, like, should I go see a chiropractor?" Like, "No, it's so dangerous. You could have a stroke." 1 in 5,000,000. Okay, so if I had a quarter here and I was like, "Let's flip this coin, and I want you to get heads." How many times in a row
Mm.
would you have to get heads in order to get to 1 in 5,000,000?
Oh, many, many.
It's 20 times in a row.
Yeah.
Yeah, if you can do that, awesome. Go to Vegas. Like, stop listening to the podcast, get to Vegas right now. And so it's extremely rare,
Yeah.
but they talk about it like, we're sending about like 5 or 10 people to the hospital every week with strokes. Absolutely, absolutely not true.
Right.
Absolutely not true. 20 years of practice, I've had 0 serious adverse
Oh, like, good to
events.
know.
Yeah, and it's because it's a really safe form of healthcare.
Mhm.
You know what it's safer than? Medication.
Yes.
It's safer than ibuprofen. You
Ibuprofen,
know how many people die from
Tylenol.
ibuprofen every year?
How many?
16,000.
Oh my gosh.
You know how many people die from chiropractic every year?
How
Well, if
many?
you look in the literature, cases of death
Yeah.
associated with chiropractic, there's maybe 2, 3 dozen. That's in the 130-year history of chiropractic.
Oh, in the
Yeah.
whole history.
In the whole history.
Oh,
Yeah, if
wow.
you look in the
Okay.
literature. And
Mm.
so, yeah, but by all means, ibuprofen, it's yeah, like they sell it at Fred Meyer, you could get it anywhere. Ibuprofen is killing people like
Huh.
crazy
Yeah,
comparatively,
compared to
right?
yeah.
But is ibuprofen safe?
No.
Well,
Yes. Now
I
that you tell me,
I think it's
maybe
pretty
it's not.
safe. I think it's pretty safe. But comparatively, like nobody talks about that,
Yeah.
right? And they're like, well, you should be disclosing to everybody that they could have a stroke
Mm,
if you manipulate them.
mm.
Are you disclosing to everybody that if they take ibuprofen that they could bleed out and die?
Yes. Yeah.
They aren't, but
Right.
it's like it's because it's safe,
Yeah.
right? And chiropractic in general is safe. Do we have people that commit malpractice? Absolutely.
Mhm.
But
Sure.
so does everybody,
Sure.
right?
Yeah. Yeah.
Yes. So, okay. Whew. Ah, it's so good to get that out. I'm just so glad to get that out.
Yeah,
Thank you,
feels good.
Kathy.
Feels good.
No, it's what you do, what I do, it's
Mhm.
really, really safe, and it's easy to protect people. But we just have to decide to work together. And I think it's really about the relationship
Yeah.
building. You just got to find people that you trust and work
Yeah,
with
we
them.
have really good I think we're lucky in this area too. The physicians in this area really seem to trust PTs and
I
chiropractors
think so.
because
Yeah.
we get a bunch of referrals from physicians that are great.
Yeah.
I don't know if that's the same, throughout our great nation of ours.
It's not definitely not on social media. Holy smokes.
But I would say in
Yeah.
the valley here,
Mhm.
the physicians here really trust and value.
There. It's
Um,
an excellent place
yeah, it really
to
is.
to practice this way.
Yes, we'll be
Mhm.
hiring soon, so
Yeah.
it's a great place to be a PT.
Yeah. Yeah. There was one other thing that I was gonna say. Maybe it's not important, and that's why I kinda blacked out on it, but, I think it's this, is that, um, there in healthcare, there are bigger fish to fry
Mhm.
than other
And each
types
other, yeah.
of
Yeah,
practitioners, right? Like,
yeah.
let's fix iatrogenic MRSA infections,
That
right?
would be
Iatrogenic means it was caused in the
in the
hospital,
hospital, yep.
right?
Mhm,
And, there's some people that go in with
mhm,
nothing and they leave
mhm.
with
Was
MRSA and they die.
worse. Yeah,
And,
yeah.
so it's like and I'm not it's an incredibly difficult problem to solve, but, it's solvable, and let's focus our efforts on things like that, things that are actually hurting people. There is not an epidemic of people that are being hurt or injured by people who, are non-MD doctors,
Right.
right? Dentists are pretty safe. They're not really hurting well, actually, they hurt people all the time. That's kind of their job. Never mind dentists, we're leaving you out of this. Let's go to optometrists. Optometrists,
They're great.
so
The
great.
best.
Oh,
The
yeah.
best
Screw you,
doctors you could
dentists.
find. Yeah.
Optometrists, you're amazing. Chef's kiss. Yeah,
I
anyway.
have the best
Now
ones.
we're probably never gonna be able to get a dentist on this show. I
Probably
probably
not.
close that door forever.
Yep.
All right.
They're probably not
That's
listening, though.
fine.
Dentists aren't listening.
We have so many dentists in Corvallis
We do
too.
have a lot.
Yeah,
A
and
lot of good ones.
I feel kind of bad because I'm friends with a lot of dentists,
Mhm.
and I think some of them are like, "Bro, how come you don't come see me?" And I'm like, "'Cause
So many.
the other guy was first, I guess." We have a lot of
We have a
dentists.
lot.
We do, and they're all great. Love
Mhm.
all you
Yep,
dentists.
they're great.
Just kidding.
Love
No,
'em.
I'm just kidding, I do.
Alright, is it time for a game? I'm very excited because
Oh my gosh.
I am running this game
Holy
this
crap.
time.
Yes, I know. You
Yeah.
told me you're like, "I got the game."
Yeah, I got the game.
And so, all right. I think last time that you ran a game, like I was really on the hot seat.
Yeah, now this one you're gonna I think it's right in your wheelhouse,
Okay. Is it
and you're gonna
trivia?
like it. It is trivia.
Yes.
And even better, movie trivia.
Movie trivia.
And even better, Christmas movie trivia.
Christmas movie trivia. Okay. So all questions about Die Hard.
Well, maybe.
Okay. All right. Let's do it.
So I'm gonna read a
Yes.
quote, and you
Okay.
have to name that movie.
All right. You filthy animal. Let's do it.
Oh, that was already one of mine. Okay.
I'm winning already. I don't know what movie that's from though, but okay.
You don't?
I think I do.
Oh, okay.
Yeah.
All right. Well, it'll be one of the questions.
Okay.
Okay. Number 1. I want official Red Ryder carbine action 200
Yes.
shot range model air rifle.
Yes, that is A Christmas Story.
Yes. Ding, 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 ding.
Just a wonderful
Okay.
movie.
Yeah. Starting
Yes.
off easy for you.
Okay.
Okay. Here's a good one. Every time a bell rings, an angel gets his wings.
Yeah, I hate that movie. It is gosh, it's with that old guy.
Yep.
It's a Wonderful Life.
Yeah.
there we
Very
go.
good.
Oh man.
Okay.
My mom used to watch that. And she'd be like, you should come watch this with me. I'm like, what is even happening in this movie? Like
It's kind of
my
depressing.
ADHD would not let me consume
I
any
bet.
of that. Yeah.
Oh, yeah. You are
Okay.
not engaged in that. All right. Ready?
Yes.
Jelly of the Month Club? Clark. That's the gift that keeps on giving the whole year.
Oh, vacation, Christmas vacation.
Yes.
That was great.
By the way, my favorite probably of all Christmas movies.
Oh man, those poor Griswolds and their pool. It didn't happen. Yeah, that's that's a wonderful movie.
Right?
She's a beaut, Clark. She's a real beaut.
Okay. I passed through 7 levels of the candy cane forest, through the sea of swirly, twirly gumdrops, and then I walked through the Lincoln Tunnel.
Oh, not even a challenge. I was in this
You
show.
were? Of course you
yes.
know it.
This is Elf. I was in
Forgot.
Elf the musical.
That's right.
Yes, I played Black Santa.
Yeah.
Which that's not how it's scripted,
No.
but when I'm black and I'm
That's right.
Santa,
And
yeah.
in Corvallis,
Yeah,
that was a shocker.
You know what I think I'm going to do is when we have our premium subscriptions with this episode, I will have pictures of me in makeup, like getting into my Santa thing. But yeah, I was a mall Santa, the one who smells like beef and cheese. Oh, great movie. Elf. Dun 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 dun. Dun, 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 dun,
I
dun,
bet you
dun,
heard
dun.
that a lot.
Yeah, there's people who are probably listening to this while they're driving. They're like, "Oh my gosh, Spotify just switched over to the Elf soundtrack. What happened to the Pitch
Sounds
podcast?"
so authentic. Okay.
You know the best way to spread Christmas cheer is singing loud for all to hear.
Oh,
Okay, anyway.
That's on the.
All right,
on here
this
too.
is such a great game.
I
Thank
told you.
All right, keep
It
going.
was in your wheelhouse. Okay. Will you please tell Santa that instead of presents this year, I just want my family back?
Oh, that is Home Alone.
Yeah.
Okay,
Good
all right.
job.
Which I hate that movie. I do not like Home Alone. But yeah, that one made sense.
Yeah.
Okay.
That's a tough one. Okay. Well, you're gonna get this one, but it's one of my favorite quotes. So I gotta say it. You sit on a throne of lies.
That is also Elf.
That's
oh,
right.
yes.
That's one of my favorite ones.
Mm-hmm.
All right, this one's gonna be a little bit harder.
Okay.
But I think you got it. And why is the carpet all wet, Todd? I don't know, Margot.
Why is the carpet all... Raoul's over there nodding. He knows. He goes, why is the carpet all wet, Todd? I don't know.
Julie
Margot.
Louis-Dreyfus. Did you know she was in this movie? That's why I like this quote.
Oh my gosh. I think I just missed a trivia question. What is it?
It's Christmas Vacation.
Is it?
The Neighbors. Remember?
Oh, yes. When the
Clark
comes through it comes through the window.
And it melts.
Yes.
And she doesn't know how the
that's
window's
right.
broken.
That is her.
Yeah.
Oh, my God.
Todd.
Oh, yeah. Gosh. Oh, man.
Okay.
Good one.
Um, "You'll shoot your eye out, kid."
That is also a Christmas
Mhm.
story.
Alright. Last but not least.
Okay.
"Yippee-ki-yay, mother trucker."
That is the Christmas movie. That is Die Hard.
Yeah. So I see where
Okay.
you stand on that debate.
That is definitely a Christmas movie. Absolutely. Okay, I got one for you.
Oh gosh. Okay.
Dusty Dinkelman? That's the name of a character in it.
Is that a
Or I'll
Christmas
sing you a song
story?
from it.
Oh.
And I swear by the moon and the
This is a
stars in
Christmas
the sky.
this is a Christmas
Oh,
movie?
yes, starring Ryan Reynolds.
Oh, I don't
Just
really.
Friends.
Oh, oh,
Mandy
okay.
and I watch that
Okay.
every year,
That's your
and yeah,
tradition?
and
Okay.
people forget that that is a Christmas movie.
Okay. Yeah, I didn't know that
Have you
one.
seen it before?
No.
It's
Is it
oh my
good?
gosh, yeah, you're
Alright.
welcome. That is my gift to you
Okay.
this year is go watch
Merry
Just
Christmas,
Friends. Oh
everybody.
my goodness, it's funny. It's a funny one. All right, take homes.
Okay, take homes. I wish physicians knew um how we can educate people on pain.
Okay.
Yeah.
And I wish physicians a Merry Christmas and a Happy New Year. So which one of us is gonna get a referral? No.
Uh, good one.
No,
Good
I
play. Good play.
networking's the key.
Yeah.
We just gotta get to know each other, and it's
Mhm.
difficult because everybody's busy, but that's one of the
Yes.
things I actually love about doing the podcast
Yeah.
is we're able to make some really good
Mhm.
connections, with some other providers, and it takes down some of those walls, and
Yeah.
so I feel more comfortable sending people to them
Yep.
and vice versa, and at the end of the day, it's patients who matter, and it's
That's
patients who win.
that's who
So,
matters. Yeah.
mhm.
Yeah.
Yeah.
Yeah. Oh, one more thing.
What's that?
What's that?
There's
There's
no
no
I
I
in
in
pitch.
pitch.